A miscarriage is the spontaneous abortion of a fetus before it's developed enough to survive. This can happen even before a woman is aware that she's pregnant. A miscarriage usually occurs in the first 3 months of pregnancy. A small fraction of miscarriages, less than 1%, are called stillbirth, as they occur after 20 weeks of pregnancy. In most cases, a miscarriage cannot be prevented because it is the result of a chromosomal change or a problem with the fetus that occurs during conception or during early fetal development. So how can a mother realize that they are about to lose their baby?
Any vaginal bleeding, basically, within the pregnancy, that is not normal, it should not happen. So that's the chief sign, vaginal bleeding, and of course, lower abdominal pain.
Many women may not even know that they have had a miscarriage, thinking that what has happened is just a particularly heavy menstrual flow. Some women may experience cramping, spotting, heavier bleeding, abdominal pain, pelvic pain, weakness, or back pain. Doctors, however, say spotting is not always a sign of miscarriage, especially if it occurs early into your pregnancy.
Any bleeding in pregnancy is not usually a good sign. Okay, so she needs to see a health worker or a doctor immediately. Then they'll have her assessed, and usually this assessment will include an examination in a pelvic and also vaginal examination. We're looking for bleeding. We also need to look at the, things like the cervix. Is it open? Is it closed? Those will give us a guide on if it's maybe she's having a miscarriage or is she just threatening?
The most common cause of pregnancy loss is a random chromosome abnormality that occurs during fertilization. But other factors that could contribute to a miscarriage may include abnormal hormone levels in the mother, such as thyroid hormone, uncontrolled diabetes, exposure to environmental and workplace hazards, such as radiation or toxic agents, certain infections, uterine abnormalities, weak cervix, and use of certain medications. Certain behaviors also increase the risk of miscarriage. Smoking, for example, puts nicotine and other chemicals into the bloodstream, causes the fetus to get less oxygen, and increases the chance of losing a pregnancy. Alcohol and illegal drugs can also lead to miscarriages. For stillbirth, which usually occur after about 5 months of pregnancy, the causes usually include disorders of late pregnancy that involve high blood pressure, fluid retention, and protein in the urine, uncontrolled diabetes, infectious diseases such as syphilis, herpes, rubella, influenza, and malaria, severe birth defects such as spina bifida, post-maturity, that is when a pregnancy has lasted over 40 weeks. One can take precautions to increase the chance of having a healthy pregnancy. Doctors say one should maintain a proper diet loaded with folic acid and calcium, exercise with the doctor's approval, maintain a healthy weight, not overweight or too thin, avoid drugs and alcohol, limit caffeine drinks such as tea and coffee to no more than 1 to 2 cups a day, quit smoking, get immunized against communicable diseases, and know your family medical and genetic history.
Well, it's threatening. Usually bed rest is the main thing you can do. Bed rest and monitoring. Basically, that's all you can do.
Above all, doctors advise pregnant women to go for all their antenatal appointments and discuss their concerns. Anna Tkunda, NTV.
Thank you.